you have fibromyalgia, your brain is not broken, but it might feel like it sometimes. Because of how complex the condition is, doctors don't always get it right when diagnosing you or explaining what's going on. So let's break it down. First things first, what is fibromyalgia? It's a disorder characterized by ongoing and widespread pain, accompanied by fatigue and other somatic symptoms, meaning those that affect the body. The most common are sleep problems, mood disorders like anxiety and depression, and cognitive difficulties known as fibromyalgia fog. Now, if you've heard of fibromyalgia before, you might already know that pain is the main symptom. But unlike other pain conditions, the discomfort doesn't go away with rest. Instead, it tends to linger. And the more you try to rest, the worse it gets. A good night's sleep should make you feel better, right? Well, not exactly. Fibro, you can sleep for 12 hours and still wake up aching. The pain itself is described as deep, aching, and tiring. It can feel like a constant dull roar in your muscles. Some people say they feel like their bones are made of glass. This sensation is due to the malfunctioning of your central pain system, which includes the spinal cord and brain. You see, everyone experiences pain when their nociceptors, or pain receptors, send signals to the spinal cord. But in people with fibromyalgia, these signals get amplified, so the pain you feel is much more intense than the situation warrants. Not only that, but other sensations like temperature changes, pressure, and even emotions can trigger pain. Normally, the body releases chemicals called neurotransmitters to stop the pain signals from reaching the brain. But with fibromyalgia, those chemicals aren't released or they're not working properly, so the signals keep coming. This results in chronic widespread pain. But that's just the beginning. The fatigue associated with fibromyalgia is the good old-fashioned kind that comes from a hard day's work or a busy week. It's more like an overwhelming tiredness that never seems to go away, no matter how much rest you get. And it's not just physical either. People with fibromyalgia often experience mental fatigue as well, making it hard to concentrate and think clearly. This is often referred to as fibromyalgia fog. It's not that you're lazy or unmotivated. Your brain is genuinely struggling to function at its best. So why do doctors sometimes have trouble believing you? Well, for starters, there's no single test that can diagnose fibromyalgia. Doctors tend to rely on a patient's symptoms to make a diagnosis. But since those symptoms can be vague and overlap with other conditions, it can be tough to figure out what's really going on. For example, many people with fibromyalgia also have chronic fatigue syndrome, which can make it hard to tell which one came first or if they're related. Not to mention that many conditions have similar symptoms such as arthritis, lupus, thyroid disorders, diabetes, and irritable bowel syndrome, just to name a few. Another reason is that fibromyalgia is often associated with psychiatric disorders like depression and anxiety. Unfortunately, this creates a stigma that patients with fibromyalgia have to deal with. When their pain isn't taken seriously, it can be incredibly frustrating. But remember, your pain is real, and so is your experience. While there's currently no cure for fibromyalgia, there are treatments available to help manage the symptoms. So don't lose hope. If you've been feeling unwell and seeing doctor after doctor without getting a diagnosis, consider asking them about fibromyalgia. It's important to remember that you're the expert on your own body. If something doesn't feel right, don't give up until you get answers. Knowledge is power, and understanding your condition is the first step to finding relief. Thank you so much for watching and supporting our channel. Don't forget to like and share this video if you think it will help someone else. We'll see you next time.